As I reflect on the journey of P2P, I'm reminded of the fundamental core values that have guided us from the very beginning: transparency, integrity, teamwork, and the deep commitment to filling the gaps in healthcare, education, and social needs. These values are grounded in our belief that people's problem can be solved by people, and that together we can make a lasting difference. Today, we are part of something bigger than ourselves. P2P has always been about serving a cause greater than any individual, because as we all know, mortality is 100%, but the legacy we leave behind is determined by our collective actions. Our triangular partnership model has been a cornerstone of our success. It's a model that bridges the gaps between local, national, and international efforts. It has enabled us to weld theory with action, bringing practical solutions to the communities that need them most, while also fostering indigenous capacity. This has been the brainchild of P2P from its inception, and this continues to be a driving force in all that we do. As we look to the future, we are excited about the potential of artificial intelligence to further our mission. We believe artificial intelligence can eliminate many of the limitations that have hindered us in the past, helping us to advance public health, medical care, and close a knowledge gap that exists across borders. We envision a future where technology serves humanity, promoting health equity, and empowering communities to serve their own challenges. I feel incredibly fortunate to be part of this movement, and I am humbled by the dedication and passion of each and every one of you. Together, we have built something remarkable over these 25 years, and together we will continue to innovate, serve, and inspire. Let us use this moment not only to celebrate our past accomplishments, but also to look ahead with renowned commitment to our mission. The journey continues, and I have no doubt that the best is yet to come. Thank you, and here is another 25 years of people to people.
Thank you, Dr. Naugao, for highlighting some of the achievements done in the last 25 years, and also heading forward for the next maybe so many years, 25 years, maybe more, of our commitment. They said 1,000 miles starts with one step. So hopefully this will clear the road ahead in improving the situation in the other part of the continent. Based on the schedule, as you know, the first part of the first 1 hour is going to be devoted some kind of messages from different representatives of people from Ethiopia. And also we have one actually talk before we go to the next session. So we were expecting Ambassador Ervin Joseph Mesgina to give some kind of introductory remark. This is not the first time happening. We have been doing this for all years to call representatives from different parts of the country. And he has a message sent to us by Ambassador Mesgina, and Dr. Zowdu is going to read for us.
Good morning, everyone. Ambassador Masinga could not be here today with us, so he sent a message from the United States Department of State, and it reads as follows. Dear P2P board members, executive leaders, and staff, on behalf of the U.S. Department of State, I would like to extend my heartfelt congratulations on the 25th anniversary of People to People USA's founding. A quarter century of work in the health sector and beyond in both the United States and Ethiopia is indeed a significant milestone and a major achievement to be celebrated. I am impressed by the breadth of your programs, from fellowships and scholarships, academic accreditations and quality assurance, girls' boarding and care centers, testing centers, to sponsoring orphans. And these are just your current programs. I'm sure it's impossible to count the many students, organizations, and children whom P2P has helped and whose lives you have improved. To all the people supporting P2P board members, leaders, staff, and individual donors, thank you. Each of you is testament to the power of one person joining a collective to contribute towards a greater good, helping others and improving communities. My best wishes to P2P for another 25 years, plus many more years of positive impact. Sincerely, Ambassador Erwin Masinga, United States Ambassador to Ethiopia. Thank you.
Dr. Zawdu is the country representative in Ethiopia for People to People. He came yesterday and he brought the letter from there yesterday. As most of you, all of you know, that People to People is non-ethnic, non-religious organization and trying to promote health and other problems facing our country. And each and every time, People to People try to work with the representatives of our country, our Ethiopia, and the next person to address. Really, we have to involve any kind of activities you do with the people who are working on the ground there. So, Her Excellency, Dr. Maqdas Daba, is going to address how Ethiopia may be helping in addressing health issues using artificial intelligence in the next decade. I am sure there will be someone who is addressing her because of her busy programs. A representative from Ministry of Health going to address via Zoom.
I'm Prayot. I will try to address a keynote speech on behalf of Dr. Maqdas, since she was on another engagement. Dear ambassadors, heads of organization, dear Dr. Nago, P2P president, dear P2P board members, ladies and gentlemen, esteemed guests, it's an honor to join you today as we celebrate the 25th of impactful services from P2P. Over the past quarters of a century, People to People has remained steadfast in its commitment to advance healthcare, education, and also community empowerment, both in Ethiopia and beyond. As we reflect on P2P journey, we see an inspiring example of how dedicated professional and also compassionate individual can come together to solve critical challenges. P2P visions that people's problems are best addressed by the people themselves, which has been the foundation of its remarkable successes. From establishment, life-saving health programs to enhance education systems, P2P impacts has reached far and wider, transforming countless lives. People to People's dedication to work with universities across the countries has fostered a culture of continuous learning and also professional development. Most notably, People to People has recently launched an adult hematology oncology fellowship in partnership with St. Paulo's Hospital, which is the first of its kind in Ethiopia. This initiative is an important step forward in addressing the growing needs for specialized care in cancer treatment and also advancing the medical professional in the country. Furthermore, P2P has played a key role in accreditation efforts in partnership with Minister of Health and also educational institutions, ensuring our universities meet institutional standards. These initiatives are helping to secure the future of our healthcare forces, ensuring that our professionals are equipped with the skill and knowledge needed to meet the evolving demands of medical fields. Dear colleagues, friends, and distinguished guests, The Ethiopian diaspora stands as a powerful reserve of talent, experts, and resources, which profoundly potential to drive a positive changes and innovation in healthcare. Today, we embark on a journey to explore the fundamental values of diaspora engagement and also the tangible benefits it brings to our national health infrastructures. Leveraging diaspora expertise, strengthening healthcare delivery systems, and also facilitating knowledge transfer and technology advancement are just some of the ways in which diaspora engagements has an impact for far beyond our borders. Indeed, it is a catalyst for progress, offering paths towards enhancing access, quality, and also equity in healthcare services for all Ethiopians. Dear colleagues, friends, and distinguished guests, today as we celebrate the 25th years of P2P, we are looking ahead to a future where people to people continue to play a leading role in empowering community, advancing healthcare, in fostering innovation. In charting the course for our future action, we must focus on enhancing skill transfer, leveraging digital learning platform, fostering continuous professional education, facilitating faculty exchange programs, and also investing in critical health services such as hospital infrastructure and local pharmaceutical production. I invite you to participate actively in our efforts to build a state-of-the-art hospital that will serve as a beacon of hope and healing for the community across Ethiopia. This hospital will not only provide essential medical care, but will also serve as a center of excellence where innovation and compassion meets to uplift lives and transform futures. Furthermore, I urge you to lend your expertise, resources, and support to the creation of in-country capacity for pharmaceutical production. By localizing the production of essential medicine, we can enhance access to affordable healthcare solutions and reduce our reliance on external sources. As we embark on the journey of collaboration and innovation, let us remain steadfast in our resolution to build healthier, more prosperous Ethiopia, and finally, for all of the world. Finally, I wish you all fruitful deliberation and congratulations to P2P on the incredible milestones. I thank you.
Thank you, Dr. Freot, even though she couldn't hear me, for really encouraging remarks that they are aligned to work with us and other diaspora population in alleviating the problems that we had at home. Really, one of the secrets why people to endure all those quarter of a century is really the best characteristic of people to people is giving something and not expecting in return nothing. Really, that is the highest climax of giving. Giving when you are expecting something is different, but giving to betterment of others is really the blessing. And our next speaker is, so today's theme is, as you said, artificial intelligence. And nutrition or food is really one of the necessities, and we hope artificial intelligence may also play in terms of nutrition. So our next speaker she's a nutrition specialist, a registered dietitian, and nutrition professor over 2 decades, overall in the field of nutrition. And she was born and raised in California. Dr. Diva, it's called Dr. D, is known currently as work as senior dietitian for Encompass Health Rehabilitation Hospital in Maryland, USA. She completed her PhD dissertation in public policy and administration from Walden University, exploring maternal nutrition knowledge and attitudes in Aljar district of northern Ethiopia. She also has a wide variety of different experiences in nutrition that encompasses global health, academia, community, clinical nutrition, and has taught nutrition to undergraduate for many years. So she's here to tell us really the relevance of artificial intelligence in the field of nutrition. Dr. D.
Thank you so much for having me, take the opportunity to present this here. I am very pleased and so honored. Just a little overview. Dr. Habte, we met about 10 years ago. I did my PhD dissertation in Ethiopia, and it was in Mekelle University, and I had traveled to the country 3 times, and it was considered to be one of the best experiences of my life. So what I did is a study with maternal nutrition knowledges and attitudes between 2 villages in the Alaje district. So that was a fantastic and awesome opportunity back in 2014. So I'm very happy to give you an opportunity to talk about artificial intelligence and nutrition. Just a little overview of who I am. My background is in nutrition. I've been in the field of nutrition for close to about 25 years. I'm a registered dietitian, and I have my own business with my business partner. Her name is Shabnam Nirmand, and we do nutrition and health consultation online. And so our focus is predominantly looking at the holistic aspects of artificial nutrition, which includes AI and nutrition. So we want to look at that particularly at that point. Oopsie, well, I think I'm going to go forward with this. Okay, here we go. So when we talk about AI, we know there are a lot of wonderful things about AI. And we know that there are, aspects of AI that we can utilize within our daily life depending on our profession. In the field of nutrition, because there are so many complicated little details that you have to look at when it comes to doing counseling and being able to get to know a patient overall, AI can be very. Oops, looks like we lost it. It can be very helpful when it comes to the personalized recommendations for each and every individual. It depends on where you want to do nutrition counseling. It depends on the particular environment. Currently, I work in addition to having my business, I work with Encompass Health. It's a rehabilitation facility in Bowie, Maryland. And when you have a number of patients that you have to see on a daily basis, you do not have the time to go through each and every patient to go and ask each patient in detail of certain questions, because there are only so many hours in a day. But AI is there for the purpose in helping to bring some recommendations that is for each individual in terms of both nutrition and health. And we try to revolutionize the diet and looking at each person is how they are, because every person is different. Here in the United States, we have all kinds of different ethnic backgrounds and nationalities and cuisines and whatnot. So we have to be able to look at how each and every person will fit into the box in terms of the particular plan that we need to plan out. So enabling that nutrition and helping professionals, it helps to focus on overall on the lifestyle. We look at lifestyle particularly because if you take a good look at our country here in the US, we have a serious problem with obesity, diabetes, heart disease, and hypertension. It plagues just about every single community, ethnic community across America, and I'm gonna have to say around the world. And it's not necessarily because of the diet, it's because of the lifestyle that we need. So we gotta make some changes in our lifestyle to ensure we can eventually make ourselves feel better and promote better health outcomes. And so it is best suited, however, only not for inpatient, but for the outpatient recommendations. So if you really want to help a patient be able to change their overall lifestyle, you got to look at the behavioral modification factors, you have to look at their attitude, you have to look at their age, as well as also all the other different things that really bring the lifestyle. This includes their sleep, this includes are they going to the bathroom properly, are they exercising, are they honestly doing a good job when it comes to stress management. And while the initial focus is on acute care, okay, acute care, however, can only provide so much, whereas long-term care is the one that is going to be most beneficial when it comes to looking at AI and nutrition. All right. Medical nutrition therapy is a big part of being a dietitian or a nutrition professional overall. Even if you choose not to focus on clinical nutrition, because there are many different specialties nowadays, we still look at medical nutrition therapy because this essentially talks about the objective factors of the patient, like the ideal body weight, the usual body weight, the percentage that is adjusted body weight. For example, if a person is an amputee or has like an amputation that is from the knee or the hands, etc., it has to be adjusted. We need to also look at other things, like if the person does have an issue with heart disease or diabetes, etc. We need to look at the particular decisions that we can make in terms of what medical nutrition therapeutic outcomes we want to focus on. Things, for example, chronic kidney disease, stages 1 to 5. Anyone who has who wants to research and look at some other types of diet, setting appropriate goals, looking at the different labs, because for a dietitian, we do not go to every single, unlike the physician, we focus on certain, like the basic metabolic profile, we do not go on all of it, but we want to make sure that when we look at those lab data, we want to address each of every of the factors to make sure that patient is eventually going to be benefiting from the recommendations that you provide. So medical nutrition therapy is extremely important. You want to focus on making sure that the patient that you are providing these recommendations for is definitely going to utilize these recommendations in the long run. So there are benefits there, definitely, okay? And we look at, like I said, personalized meal plan. If you were to sit with the patient and talk to them about what they really want to do with their life. They come to you for, say, they want to just lose weight. I mean, losing weight has just become so routine now. But what is it that they honestly want to achieve in the long run? What is it that you want to focus on? This is where you have to sit down as a provider and talk to them one-on-one and find out what they really want to do. Okay, and it doesn't matter what language that you communicate with them, whether it's in English, whether Amerindia, whether Tigrinya, et cetera, you really want to get to know the person and find out what that individual truly wants in the long run, okay? You want to see the type of food that they eat, the dietary aspect, the supplement, and all the different things that you want to focus on. So yes, AI has been utilized quite a bit for a meal plan, but it also has been utilized for on local and state government levels, especially for helping to promote food security, and it could be utilized for the reducing excess food waste and looking at statistics for the purpose to see what we could do to, say, solve a particular problem. So there are lots of different things that you could do with AI, and to provide that information that can be done, that can be very useful and helpful in the long run, and can save quite a bit of time. It can be also quite a bit of a convenience when it comes to looking for a nutrition-related issue, okay? And some of the benefits we want to see, we would like to look at the personalized insights. We would like to look at accurate data collection. What is it that we can honestly combine and compute when it looks at data, and how do we interpret that data, okay? AI makes it easier to obtain those values. And looking at the convenience, looking at the different types of integration aspect, and also the wellness tracking. So like I said, this probably would be very beneficial if we were to talk to people in an outpatient setting. If you were to do conduct a class or do some teaching and education, because it's not just enough to provide medications to help with the symptom and to make them feel better. You want to get down to the root cause of the problem for that particular patient or client. And you want to do what you can to ensure that that patient will eventually improve in his or overall health outcome. So that is the one thing about being a healthcare professional, no matter where you come from. You really want to do what we can to help the person feel better as much as you can. And AI is there for the purpose to bring a lot of the data and the information in to help for that purpose. Okay? Now, there are disadvantages of AI, okay? I have worked as a professor with the UMGC and with the Howard Community College as an adjunct for many years. And the one thing that I tell all of my students is that when they write their research papers, is to make sure that they need to write, that original information. AI, unfortunately, has been utilized a lot these days for like plagiarism purposes, and students like to cut and paste, and that is just unacceptable and unethical. But it also has to do with the way that HIPAA, as you know, every health professional needs to know it could be violated because of how it's stored, because of how it's used, and you want to make sure that you protect the patient's confidential information to the best of your ability at all times. You also want to make sure that the software program that you're using to document that is, oops, we lost it for a moment. We want to make sure that it is needed for the purpose to, keep and store the data properly and go back to it when if you need to research it. It can be very expensive for people who have, who are low income. They don't have much of an internet connection, okay? If you were to look at AI in the developing world, all right, in other places in the world, you are not going to be able to find too many individuals when they don't have any access to electricity to use a computer. So no education, the high cost, limited access, if there's some certain items like you will find, say, in the Ethiopian diet, or even my family happens to be from India, that you cannot really find it, then you have to do your own research. You have to kind of go back to the basics and not depend on technology so much, to go back and do your own research to find certain item, okay, if you really want to get to the bottom of, say, a particular problem. And you also have to take into consideration that nothing beats that face-to-face interaction. Let's be honest, guys, okay? We all do everything, many of these online telehealth consultation, and from all around the world. But when you look at a person, when you talk to that person, and the ability to show that empathy, compassion, and the motivation, that respect and trust, and being able to promote that kindness, okay? That's something that's not taught in a classroom. That's something that life experiences bring. But that is something, all of these have to be brought as healthcare professionals. We got to learn how to do this. We got to learn how to utilize it. And this is what AI cannot provide. Okay, it just gives all this information, but how you interpret that information and how you're able to interact with the people, the person, or your audience, etc., is something that is uniquely human. Okay, so these are all the different things, the dependence on technology. If people, today, you will never find here in the US anybody without a mobile phone. It was not the case 25, 30, 40 years ago. I grew up in an era where we didn't have all of these online things. The internet was not even there. But internet and the net and having self technology, we can't even imagine our lives as it was, say, 30, 40 years ago. Things were very, very different. So maybe that kind of mentality, especially for the younger generation, has to be somewhat taught to them, that you don't need to always depend on technology. But that is one disadvantage of AI that we look at. All right? So the bottom line is that we want to know what our limitations are. We want to make sure that you know what your strengths are and your weaknesses, and do not depend so heavily on technology. You know that AI, it's going to be a helpful tool, but it shouldn't be something where you can forget about everything else and just say, if I don't have AI, I can't do anything about it. But that is the attitude, unfortunately, that has been sort of adopted these days. AI is a wonderful technology, but you got to make sure you have to use it responsibly. You also have to make sure that the tools that you are using are going to be, beneficial for your work. It's going to be helpful for your client. If you are not sure about something, if you when I was doing my PhD, okay, when you go to the rural villages, we don't have any access to any of these computers. I couldn't go in you gotta go type up everything. You go to each and every one of the villages and take down the information and talk to each and every one of these people who are gonna be participating in your study, face to face. And that is, I think, something that needs to be taught today, because sometimes it's not, you say technology is a wonderful thing, but you got to go back to the basics at some point. Am I correct? Really? So conducting your research, do it and look it through your own eyes. And don't depend on AI. Yes, AI is there, but then kind of see how you can summarize it in your own words. All right? Kind of look at it as something that is as an assistant, but not something that will replace it, okay? And also understand the limitation, shortcomings, and strength. And when you learn something new, do it the right way, okay? Do it in a way that you know is gonna benefit yourself, but also the people that you're working with. And try to do the right thing at all times. And that is why AI is so important, and there's a balance between excessive usage as well as not using it at all. So with that, I thank you so much for this presentation. And as there was a recent Nobel Prize winner in physics, I believe by the name of Dr. John Hopfield. He won the Nobel Prize for his contribution to AI, but he said something that I think all of us should remember, that if you do not, know your limitation or know your boundary, AI can become very dangerous to you. So you got to be smart about it. Regardless of the profession that you're using or that you're going in, make sure that you're doing the right thing and know your boundary. So again, my name is Dr. Divya Selvakumar, and my business is Divine Living. And I thank you so much this morning for all of you in having me speak today. It's a pleasure.
Thank you, Dr. D, for your presentation. I think there may be some questions. Dr. D is the only one who is here. When I heard today's talk, I was just thinking about one advertisement. How do you collect information about your diet? What did you eat yesterday? What did you eat your lunch? What did you eat a month before, and so on and so forth? That information may be sometimes helpful to guide your nutritionist what to tell you. So in that pizza advertisement, the person is calling to the pizza shop. What do you want? Yeah, I need the pizza. How do you know? Do I need to use your Visa card? How do you know? Do you want me the full? So really, because of this, the way we are buying, for example, what I buy in the supermarket, what I eat in the, since it is very interrelated, do you think that AI can collect every kind of information about you, the type of food you buy, the type of food you eat? Can that help you in guiding individual advice in terms of nutrition?
So yes, as I was saying, when it comes to talking to a person, and when you do a counseling session, when you interact with them, and you find out the different things, you gotta take the time to sit down and talk to your patient. It is really difficult to do that these days, depending on the institution that you are in. You don't have the time. If you are short-staffed, as you know, short staffing is a huge issue and a huge problem throughout this country. Getting qualified nurses, doctors, PAs, even dietitians, currently right now in my hospital, I'm the only full-time dietitian that's there, and I don't yet have a replacement or somebody if I have to go on vacation or if I have to take a day off. But to take the time to sit down and to talk to your patient is something we all have to do, right? And it also depends on what you want to let the patients know. How are you going to be able to educate it? So as you were saying, buying food in a supermarket, people are too lazy to cook. I don't have time. We have a very, very fast-paced moving society. We have we keep looking at the clock too much these days. When I was in Ethiopia, I remembered in Mekelle University, lunchtime was from 12 to 2. Everybody went home, and it was great. I mean, I used to, however, stay back, and people would be making fun of me. And I said, why are you making fun of me? She said, you Americans need to learn to slow down and learn to enjoy life. But the fact is, we're in this country. Can you take 2-hour lunches and you can just walk and do whatever and go home and come back? Not too many professions will allow you to do that. But that's the thing, learn to slow down. And learn to be able to when you bring food from home, and you know, I try to tell my patients, see if you can cook or something and do it, but many people say, I have no time. I'm too tired to cook. I have no time. So that's an issue here. We normally used to come from, you know, say 50, 60, 70 years ago, we had the families and everybody at home, but then with the cost of living going higher and higher and higher and higher, it is not easy to especially survive here in the US, depending on which part of the country that you are in, with just one income in a family. You need at least two incomes to make ends meet. So there are ways to go about that. Shabnam and I, we talk to our patients, we take the time to really get to the bottom of their problem. Individuals who are struggling with kidney disease or polycystic ovarian syndrome, or those with diabetes, very commonly for people who are having weight problems, etc. Right? All of these people here, regardless of where they come from, usually it has to do with a lifestyle change. And if it's from a person we are not familiar with as like a particular food that we don't know about, come from a culture that we're not familiar with, as health professionals, we are obligated to say, okay, let me get back to you. We gotta go and do our research and figure out how we can incorporate this particular food in your diet. What it can do to, how it can help you. So that's how we want to approach the whole subject overall. And AI is therefore an assistant, but then at the same time, we need to also go and do our research at some point as well. Thank you.
Thank you again, Dr. D. She also highlighted some of the limitations, that it is too early to say that AI may be competing for humans. I don't think yet it has the sympathy, recognizing the face-to-face advantage humans have. Anyone with any questions, comments? Really what I see in developing countries in Africa is it is difficult to make individual recommendation using AI. What I see is maybe the AI technology, unless we have some kind of data, it is difficult to help without having big data. The advantage for developing countries is everything is interconnected. There has to be some way of really using AI in alleviating the shortage. Here we have the excess, how we are able to help the community, the farmers from the countryside with another countryside or another city, how we are able to connect them to help in their nutrition. So if anyone who has any comment or questions, otherwise we'll have half an hour break. This is a good segue about the next panel discussion, AI in improving healthcare and other activities in developing countries. So we have really wonderful people who are working with AI, and we'll hear from them. So we have half an hour break, coffee break. Thank you.